Hello, medical students. Today, we're going to discuss an important topic in pediatric otolaryngology, congenital laryngeal atresia. This is a rare but critical condition that you might encounter in neonatal medicine, so let's dive into its details. Congenital laryngeal atresia is a severe congenital anomaly where there is a complete absence or obstruction of the laryngeal airway. Essentially, the laryngeal lumen fails to form during fetal development, leading to a blockage of the upper airway at birth. It is a part of a group of conditions known as congenital high airway obstruction syndrome, or CHAOS. The condition occurs due to failure in the recanalization process of the laryngeal lumen during fetal development, which usually happens around the 10th week of gestation. This results in a solid laryngeal structure instead of an open airway. Because of this obstruction, there is no air passage between the trachea and the upper airway, which can lead to secondary complications like pulmonary hyperplasia due to retained fetal lung fluid. Infants with congenital laryngeal atresia typically present with immediate respiratory distress after birth. Due to the complete airway obstruction, they are unable to cry or breathe. Clinically, you may observe a silent cry despite visible respiratory effort, cyanosis, and signs of hypoxia due to the lack of oxygen exchange and absence of air movement during auscultation of the chest. The condition is usually fatal if not recognized and managed immediately due to the inability of the infant to breathe. Prenatal diagnosis of congenital laryngeal atresia is possible with advanced imaging techniques. Ultrasound findings during pregnancy can reveal signs of CHAOS, such as enlarged, hyperechogenic lungs, flattened or inverted diaphragms, and hydrops fetalis. These suggest the presence of a high airway obstruction. Fetal MRI can provide more detailed images of the laryngeal and tracheal anatomy and help confirm the diagnosis prenatally. Postnatally, the diagnosis is often made in emergency settings where the neonate presents with respiratory distress. Direct laryngoscopy or bronchoscopy in an emergency surgical setting may confirm the presence of an atresia. Congenital laryngeal atresia requires immediate surgical intervention after birth to establish an airway. Ex utero intrapartum treatment (EXIT) procedure is the preferred method if a prenatal diagnosis has been made. This technique allows the baby to remain attached to the placental circulation while surgeons perform a tracheostomy to create an airway before cutting the umbilical cord. In emergency situations where an exit procedure isn't possible, a tracheostomy is performed directly after delivery to bypass the atretic laryngeal region. Following stabilization, laryngotracheal reconstruction may be considered as a more definitive repair, depending on the extent of the atresia. Long-term outcomes depend on the timeliness of diagnosis and intervention. With early surgical management, many children can achieve good quality of life, although they may require further surgeries for airway reconstruction or to address complications like subglottic stenosis. In summary, congenital laryngeal atresia is a critical neonatal condition that demands immediate recognition and intervention. Understanding its pathophysiology and management options is vital for anyone working in pediatric and neonatal care. Thanks for joining me today, and stay tuned for more in-depth discussions on congenital airway anomalies in our next session.